Welcome home. We are WNST, AM 1570, Towson, Baltimore. We are Baltimore positively into the fall time of the year here where we get to talk about good things going on in the community. I've had some recurring charities and community organizations out there that we'd love to support here, along with our Maryland Crab Cake Tour presented by the Maryland Lottery. So we're getting out. We're eating some crab cakes around town and trying to get folks out to do good things. And the National Kidney Foundation reaches to me a couple times a year. I've gotten some great food and met some great people at their Sante event. This is their fall event, and they do a kidney walk every year. I always have to get the time, the place, the date, the link right, but it's a kidneywalk.org. And we welcome Lisa Zawacki, one of our defending champions, back in as the executive director of all things locally for the National Kidney Foundation. And on the 19th of October, which is my birthday week, so I can walk it off in the backside, is they'll be over at UMBC doing this. Lisa, welcome in. How many years? We've been doing this a long time, this kidney walk, right?
Morning. Yes. Thank you for having. I'm happy to be here. Yes, this is the I think it's the 17th or 18th annual walk. So it's one of those things. This is the 75th anniversary for the National Kidney Foundation. And so this walk is kind of a big deal because we've been spending 75 years trying to bring awareness and education and get everybody informed about how to take care of themselves.
Well, education is part of this, and along my life's highway, I have met donors, I have met survivors. My wife is a bone marrow transplant survivor, which I thought involved Texas Chainsaw Massacre opener. It came in a bag. Like a kidney transplant, survivors and people that are testimony to tell this story. It really is a miraculous part of modern medicine. And in our lifetimes, how much treatment has changed, survivorship has changed. And, I've met many people, including former Ravens president Dick Cass, kidney donors as well.
Right. I think what's really a crazy, scary statistic is that 90% of people who have kidney disease don't even know they have it. And 80% of those people have indicators in their current health records right now. So there's a big awareness about asking your doctors to check, because I can speak personally. Fortunately, I'm very lucky, but I saw my numbers one year in my blood work and I thought, are they supposed to be red? I don't think they're supposed to be red. And so I didn't say anything. 2 years later, I asked, and I turns out I have stage 3 kidney disease, and I'm healthy, no symptoms, feel fine. And it's just, I think it's really easy to not pay attention to something if you don't feel well. And, kidney disease really is this underlying, very prolific. 37 million people are impacted or pass away from kidney disease every year. It's one of the top 10 killers. And so I think, this is
Also hear
one.
the word dialysis and treatment when you hear that word, right? I mean,
That's right.
disease is involved.
That's right. And I think that, we want to make sure that people are just having the conversations, right? Just asking the questions. And that sometimes that's hard because you don't know what you're asking. And so we really want to focus on paying attention, being visible, engagement. And, that's why this walk is really important. There are people who are donors, living donors. There are people who are recipients. There are caregivers. I was a caregiver for somebody who donated a kidney 20 years ago. So, I'm very lucky that it's been something that I've been aware of, but now I feel really committed to the service part of the education and getting the word out.
Well, it really does come full circle, right? When you start to
Yeah.
meet survivors. And I think it's so important that people get together and they do celebrate together. I tell my wife that all the time because my wife is a survivor 12 years later. It's just not something we want to talk about. It's just not. I mean, my wife has gotten up and given speeches. We've raised hundreds of thousands of dollars. It's just, there's a point where it's not like we did our time, but every time we get closer to this, it brings you back into the fire a little bit, but it also lets you know where you've been. And for survivors to get together and families to get together on a nice day, let's hope it's a nice day on the 19th of
Right. Fingers
October.
crossed.
We hope and all that. But you do put it this time of the year when the leaves are falling, the weather gets a little better, and it's hopefully a nice morning to take a walk on October 19th, right?
Absolutely. And we'll have food trucks. We're going to have superheroes. We're going to have some Star Wars characters. There'll be kids' corners. We're hoping to get a local marching band. We're kind of waiting on that. But, it's going to be a fun event. It's going to be something where people can come together and have some fun.
Well, it's the 19th of October. So what happens over at Erickson Field at 9 a.m. on Sunday the 19th? And first thing I need to do, and because I am Baltimorean here, so Sunday 19 October, Rams are the 12th. Oh, it's
Right.
Ravens bye weekend. Look at
That's right.
that.
That's right. We will have Major Offense, who is one of the Ravens super fans, who will be there. And fortunately, it is a bye week, so he's able to come.
Well, I encourage everybody to come back. So just sign up online, right? And this is
Right.
you
So
want to
you
get
can
some
sign
people to
up.
sponsor you, you want to walk, you want to give, you want to have information, you want to be a volunteer. All of that's available up on the website.
That's right. It's kidneywalk.org/Maryland. You can sign up. There's already teams out there. We're still accepting sponsorships. If you have any questions, absolutely, you can reach out. We'd love to talk to you. We'd love to connect you. If you have, one of the things that we do is we go into businesses and do corporate wellness programs where we're teaching the organizations about how to be mindful. And so, everything from the walk to getting together to do health screenings. We do it all, and we're really excited about being a part of the community and really in introducing these kind of new programs and
Well,
celebrating our 75th anniversary.
well, for all of you, Lisa Zawacki's here. She's from the National Kidney Foundation, and we'll talk more about local and Sante and other things that we've done here because you do different events. But the Kidney Walk is the 19th of October. It's come to me here. GBMC is my newest sponsor, and they're sponsored our hotline here, and I should give them a little bit of love too. But I'm a 56-year-old, at least I think, knock on wood, healthy guy. I haven't had a checkup in I've been married 22 years, and my wife's like, you don't get checkups. And I'm like, I'm that guy, right? So I have that wife that's prodding me and saying, dude, at some point, you got to get a colonoscopy. And I have doctors on and people like you on. And I do a whole week. I do a cup of Super Bowl every year in February, talking about everything from hunger to colonoscopies. And I finally have my colonoscopy scheduled. I'm going to brag about it. It's 8 weeks
Yeah.
from now, but I'm going to brag about it. But you worry me more with this blood work, like, because my wife is a blood machine, right? My wife had leukemia twice. I sat there 155 nights in the hospital. Thank you, Hopkins. Saved her life. And every day we would get twice a day that we would get readouts of every single thing about her blood, stuff I didn't want to know, didn't want to understand. They're bringing all sorts of things into the room to keep her alive. And it's been 11 years, and it's like a weird Sopranos fever dream to me, all of that. But to know that how science works, that I've been the idiot over the last 12 years that hasn't had my blood drawn to say, hey, how's your this? How's your that? How's your whatever
Right.
that could be? I'm actually doing that. I'm actually taking my own freaking advice, Lisa, and doing
Yeah.
that. So I just want to brag to you in the middle of a charity segment that I'm starting to listen. And I'm almost 60 as a guy, but like I'm starting to be managed that I probably should go get a checkup. What do you think?
Absolutely, 100%. I think that, especially with kidney health, that since you don't feel anything, right? You may have high blood pressure, you may have diabetes. All of those things feed into the kidneys, and nobody pays attention to the kidneys, which is why all of a sudden you're at stage 4, or you don't know it, and you have to go on dialysis, right? So I was lucky. I found out at stage 3. I manage my health and
Now,
all
what does
that.
that mean when they say you're stage 3? That scares the poop out of me. So, like, what? So, you taking a pill? You doing something? You managing this? Is there some food you shouldn't be eating? What you shouldn't drink? What should you not be doing?
It's health, being mindful of your health and what you're eating. Realistically, there's not a ton of impact. It's just that my numbers are low. So my EFRG, which is, technical kind of jargon for blood work, but it's one of those indicators. And it's just, it's your kidneys are the filter, right? And they're taking in all this different kind of stuff. If you take a lot of NSAIDs, sometimes that impacts your kidneys. Sometimes we don't know what impacts your kidneys. It just happens. So that's right. Congratulations. Go get checked out. Ask to get ask to look at those numbers. And you gotta pay attention and you gotta advocate for yourself, which are the two hardest things to do every day, right? Nobody really
Hey, just
wants to
getting on
do
the
it.
phone and making the appointment felt like a complete victory for me. Like the
Superhero,
woman called me from
superhero move.
GBMC and I'm putting it on the calendar in November and she said, "You want an afternoon appointment?" I'm like, "It's colonoscopy, right? Like this is a morning thing. Like everybody tells me this, right?" So like I went through all my education has helped me have a better colonoscopy, but I'll still say this, just getting on the phone and making the call, getting the doctor, getting the appointment, having them call you back and say, "All right, on the 10th of the month, I'm going and doing this so that on the 11th of the month, I get my numbers back and I know my kidneys are okay, or I need to eat more kale or whatever I need to do," right?
Well, you always should eat more kale, but you do get a gold star because you made the effort, right? Like you get the gold star for doing the right thing and
All
taking
right.
care of yourself.
Well, National Kidney Foundation is there trying to encourage everybody to do the right thing. And the first thing is you probably should get your blood work done and at least be aware that you have kidneys, that you could donate one, you might need one, and there are people out there in the world that need a little bit of help, and you can help them out. You can go walk on the 19th of October over at UMBC, one of my favorite places to walk. Uh,
Great.
don't tell
Thank
Pete
you so
Caringi
much.
that, but
I look forward to seeing everybody. Come
hey,
on.
and as far as you want people to walk, sign up, go to the website, anything else you need for this other than just show up with good walking shoes on the 19th? I want to give you a chance to wrap.
Absolutely. Good walking shoes. We'll have a DJ. We'll have people out there. We're still accepting sponsorships. So if somebody wants to sponsor us and help support us, that would be great. We always want to be able to give the money back to the education piece. But yeah, come out, have some food, take a walk, enjoy everybody's company, get to meet new people. And we really look forward to seeing anybody that can come.
Really, the wild thing when I've done these over a million years of being invited to a million of them, over 35 years of doing radio and have people out, is you meet miracles. Like people meet
Right.
my wife and they come up to her. It's a little bit of a religious experience for some people who remember when she was 85 pounds and bald and kind of hanging on and trying to stay alive. And now they see her and they're like, "Oh my God, you're a miracle." Well, there's a lot of miracles. And when you come to events like Kidney Walks, they're everywhere. And every story is truly miraculous. So keep up the good work, Lisa. I appreciate you.
Thank you, Nestor. I appreciate it. Everybody
Lisa
have a great
Zawacki, she's
day.
here. She's the executive director of all things National Kidney Foundation. You can learn about all that they're doing for the Kidney Walk on the 19th, and they do stuff year round. So this is a one-stop shopping here. But you can go to kidneywalk.org and learn about what they do. NKF. I've been talking about it for years, and I have so many contacts and people in my life that all this happened even before my wife had cancer. So we're out there doing good stuff and trying to raise money and yeah, get your numbers, get some education, get some
Right.
awareness,
Come
which
have
which
some fun.
yeah, and I'm trying. Hey, that's what Sundays are for, except when it's bye weekend. So you guys picked the perfect weekend, October 19th. That's the Ravens bye. I am
Right.
Nestor. We are
Excellent.
WNST, AM 1570, Towson, Baltimore. We're celebrating 27 years of fun with 27 tasty treats. All are brought to you by Curio Wellness. You can find it at Tastiness out at BaltimorePositive.com.